impact. And so just want to acknowledge that and note that we appreciate the partnership with everyone on, whether you're government or non-government members, and then just also the work and leadership of the stewards as well. So I'm happy to now turn it over to Pamela Foote, who will lead us through the public comments.
Thank you, Dr. Delphin Rittman. So as you all know, this is the portion of the meeting where we open it up for public comment. We had an overwhelming response of public comments that came in. Right now, I have tracked 22. I'm going to read each name in the order that it came to me for public comment. We do ask that each person, once your name is called, to try to limit your comment to up to 3 minutes so we can move on to the next person. As a reminder, all comments today will become part of the official meeting record and will be captured in the official meeting minutes. When your name is called, please press *9 to raise your hand or press *6 to have your line unmuted. Going to the first comment is Bianca from St. Augustine Shores, Florida. Bianca, if you are on the line, please press *9 to raise your hand or press *6 to unmute. Selby, do we have a response?
Not as of yet.
Bianca from St. Augustine Shores, Florida. If you're on the line, please press *9 to raise your hand or press *6 to unmute. All right, let's move on to Krista Gus. Krista, please press *9 to raise your hand, press *6 to unmute.
Hello, can you hear me?
Yes.
Okay, great. Thank you and good afternoon, everyone. I appreciate greatly this opportunity to give public comment. My name is Krista Gus, and I am contacting you from the Four Corners region of rural Colorado. We have very serious mental, behavioral, and social health issues here. Here is my comment and questions. What is being done to effectively introduce recent findings about the strong connection between gut dysbiosis and gut-brain axis dysregulation to serious mental health and therefore dual diagnosis addiction recovery populations? That is, if not yet being implemented, when might we expect detoxifying gut dysbiosis and restoring gut-brain axis coherence be part of treatment services? Clearly, it is an important part of individual and social health, as indicated by recent findings. If you're not already familiar, freshly minted scholarly articles, BBC article, and NPR podcast can be easily provided you to demonstrate the recent findings in modern medicine. Full disclosure, I am affiliated with Sana Vida Health and Wellness in Durango, Colorado, where we have multi-decade developed expertise in effectively addressing gut dysbiosis and dysregulation along the vagus nerve. We would like to enhance treatment services for the benefit of all, as this is a nationwide pressing need, as you all very well know. As a mission-driven for-profit, we would like to partner and collaborate with you. We are already engaged at the Southwest regional level with like-minded organizations to this end. If you have any questions or would like to connect with us further about ways that we could work together in future, you can contact me either at info@sanavita, that's SANAVITA Durango.com, or with my personal email, Kristala Gus, KRISTALAGUSS as in Sam, @gmail.com. And lastly, thank you all so much for the very important work you're doing to improve the lives of so many. We really appreciate you. Thank you.
Thank you, Krista, for your comments. Moving on to Johanna Lester. Johanna Lester, if you're on, please press *9 to raise your hand or press *6 to unmute.
No response.
Thank you, Selby. Moving on to Green Thumb with AV Youth Wraparound Services. If you're on the line, please press *9 to raise your hand, press *6 to unmute.
No response, Pam.
Thank you. Moving on to Stephen Buslam. Please press *9 to raise your hand, press *6 to unmute.
I see a hand going up, but it's for Russell Stentz.
I have Russell Stentz on my list. He's further down. We need to move on to the next one. The next person, her name is Michelle. Michelle, if you are on the line, please press *9 to raise your hand, press *6 to unmute.
No response.
Moving on to Teresa Price. Please press *9 to raise your hand, press *6 to unmute.
No response.
Moving on to Katie Dale with the National Shattering Silence Coalition. Katie, please press *9 to raise your hand, press *6 to unmute.
One sec. I see a number. Hold on one sec.
Hi, good afternoon, all. To the membership of ISMIC, we, the members of the National Shattering Silence Coalition, comprised of people with lived experience, families, caregivers, and professionals, continue to follow your policy efforts. In response to your March 2023 meeting minutes and developing issues we've observed in the last few months, we wanted to share the following thoughts. We would like to reiterate that the cost of not caring for those suffering most from serious mental illness and brain disorders at a calculated societal cost of $281.6 billion far outweighs by 4 to 5 times the speculative projected costs to the federal funding to do away with IMD exclusion law. This is an archaic and absurd barrier to care. Keeping immediate care out of the reach from the sickest does not benefit anyone and especially hurts those with the disease and their loved ones. In today's realm of science and medicine, those who would have been institutionalized before the 1965 IMD Exclusion Act, in most cases would now be receiving inpatient treatment and could use a continuum of care to recover. Another ignorance or carelessness the federal government and agencies like SAMHSA ought to address and influence Congress for is the aim to funnel federal funding into successful evidence-based programming like assisted outpatient treatment. Unfortunately, and much to our confusion, funding the AOT has declined by over $6 million this fiscal year, according to SAMHSA's projected 2024 budget released last month. When effectively court implemented, this program has been able to see a statistically significant success rate for graduates and their path to recovery. We noticed the disparities of those you've addressed in the past meetings were focused more on cultural, gender, and race-perceived discriminations. However, where we are wondering is the focus for those who are suffering regardless of their exterior identifiers and are lacking total insight into their illness, unable to comprehend that they are even sick at all with anosognosia. Where is the compassion, action, and justice for those with serious mental illness? Since the founding member of our organization, Jean Gore, passed this May, the NFSC wants to know our efforts are not in vain. Too many loved ones with SMI are sidelined to the political agenda and seasonal winds of popularity. Each day that goes by without a prioritized focus on fixing the broken system that's supposed to serve the least of these is another day a parent loses a child to a preventable tragedy and falls into the clutches of the criminal justice system, or worse, hurts themselves and or their loved ones. So we ask, what are you doing to help fix this? May eliminating the IMD exclusion and funneling funding into proven programs like AOT be part of your solution. We are the voice of those who know. We are speaking from firsthand experience. We are watching for you to act. Thank you.
Thank you. Did you also have a personal comment that you wanted to?
I did.
Thank you. You please
If
go
you would-
ahead.
Thank you. Members of the ISMIC, thank you for fielding this comment. As someone with a serious mental illness diagnosis who has recovered to the point of thriving and also has been employed in a CCBHC as a caseworker, one of the largest concerns I've seen in my years of exposure to the American mental health care system, being inpatient at two different points in my life, is the lack of accessibility to inpatient treatment. For someone in an acute episode of depression, mania, or psychosis, in most of the 50 states of America, there has to be an act already committed to justify admission, which makes me wonder why at the previous ISMIC meeting, what is the reasoning behind the Department of Justice postponing the decision surrounding IND exclusion? When a third of the prison population has a serious mental illness, and more of those with a serious mental illness are either in the criminal justice system or homeless and not receiving treatment in a proper psych hospital, there is a real problem. It would benefit every department represented here, especially the Department of Justice, who sees their work first tasked to crisis calls or who drive those in acute states to either hospitals or jails. America is sorely lacking in a good mental health care system in its lack of robust and competent psych facilities. Biden administration's recent awarding $130 million towards CCBHCs is encouraging. But for the sickest of those, the least of these, with lack of insight into an acute episode, we do still need the INDs included in any mental health care system solutions. The painstaking state-by-state Section 1115 waivers, at the rate they're going, are going to take another generation to make it standard by most states. Do I want to see that play out where my own children who potentially could inherit the same gene as me with bipolar disorder or psychotic features find herself in an acute episode and be turned away? I really feel on my watch that far be it from us to hold these discriminating laws in place. After attending these meetings for the last 2 years, I do wonder if your agency has any influence over Congress when such issues we present repeatedly are ignored or swept under the rug. I'll tell you one thing, if it's not peripheral COVID matters, it's gender and racial disparities. With all due respect to those issues, they are not serious mental illness. I hope you decide to make a difference in this regard and start by digging deeper into SMI and matters like anosognosia and helpful solutions to ending IND exclusion and federally mandating AOT. Thank you.
Thank you so much for your comment. Moving on to Ann Hookerin. Ann, if you're on the line, please press *9 to raise your hand, press *6 to unmute.
Hi, can you hear me?
Yes.
Okay. Good afternoon. As a family member with lived experience and executive director of the National Shattering Silence Coalition, I am beyond grateful that SAMHSA now recognizes family members as peers. We are the voices for our loved ones that are too sick to advocate for themselves. It is extremely disappointing and discriminatory that not much has changed for families like ours, despite seeing a substantial increase in mental health funding, and hope that our voices are heard to help change this. It's unconscionable that the projected funding for AOT in fiscal year 2024 is over $6 million less than this past year. AOT as evidence-based treatment is recognized by SAMHSA and is saving lives throughout the country. I live in Massachusetts, one of 3 remaining states without such a law. This past June, after 3 months of reaching out to DMH, CIT clinicians, and the Mass Behavioral Health Partnership to no avail, police had to break down my son's door after he barricaded the door, threatened to take his life, and stopped responding. He spent 8 days on an inpatient unit witnessing other patients expose themselves, defecate on the floor, scream, and start fights. How is this more humane than providing compassionate, evidence-based treatment in the community? Massachusetts now has 25 community behavioral health centers where anyone can voluntarily receive help. Our state, however, fails to recognize that many, because of illness itself, in all likelihood, will never be able to voluntarily access these services. Services, whether voluntary or involuntary, can be person-centered, compassionate, and evidence-based. Identifying the needs of those with SMI and developing innovative approaches should not exclude involuntary programs that provide medically necessary treatment for a population that otherwise, without treatment, we see languishing in our jails or prisons, on our streets, or dying. Our lived experience can detail the discriminatory practices that our loved ones often face. Our lived experiences too should be valued. Last month, a 78-year-old woman reached out to me looking for help in navigating the criminal justice system. Her 40-year-old son, diagnosed with schizophrenia, was arrested for violating a non-harassment order and sending a former high school classmate continuous emails. This man believed he could communicate with computers and that this woman secretly wanted to have a relationship with him. This man needs treatment, not involvement in the criminal justice system. SAMHSA's recent report on coordinated specialty care for first episode psychosis acknowledges that those receiving treatment early through evidence-based recovery-oriented services can improve the outcomes of individuals who experience psychosis and that such services are cost-effective. These same services should be afforded to every person living with a psychotic disorder. Instead, we continue to create trauma among individuals and families. Equity and inclusion cannot be accomplished if we fail to meet the needs of the most vulnerable. We ask that ISMIC focus on creating a system that improves outcomes for every person living with a mental illness. Collaboration with families is needed and essential in working towards this goal. As a fellow advocate recently said, nothing about us without all of us. Thank you for the opportunity to be heard on behalf of every family like mine.
Thank you so much for your comment. Moving on to Sandy Godwick. Sandy, if you're on Zoom, please press *9. If you're on the telephone, please press *6.
Not seeing anything, Pam.
Thank you, Sylvie. Moving on to Al Galves. Mr. Galves, if you're on Zoom, please press *9 for the raise your hand option. Press *6 to unmute if you're on the phone.
No response.
Thank you, Sylvie. Moving on to Sherry McGimsey. Sherry McGimsey, if you're on Zoom, please press *9 to raise your hand. Press *6 to unmute if you're on your phone.
No response.
Moving on to Ed Creekmore. Mr. Creekmore, if you are on Zoom, please press *9. If you're on your phone, please press *6 to unmute.
No response.
I'm showing him an attendee, Sylvie, so I'll go back to him. The next person is Julia Malclavio. If you are on Zoom, please press *9 to raise your hand. Press *6 to unmute.
Well, so you can hear me, right?
Yes.
Yes. Thank you for this opportunity. I am a member of several advocacy organizations and a mother whose daughter was diagnosed with SMI. I was very excited to provide a comment to this committee last year, sharing the story of my daughter's complete recovery through the open dialogue method. I cited research showing the effectiveness of non-coercive methods and grave problems resulting from the current over-reliance on forced treatment, such as AOT. This time, my evidence will be anecdotal. There is no hard data about the phenomena on which I will speak. While you here discuss how to improve access to mental health services, many people all over the country discuss how to escape these services, sharing tips how to hide signs of early psychosis or suicidality, how to answer risk assessment questions so as not to get hospitalized, and so on. Some are working on creating an underground railroad for those escaping court-ordered treatment and AOTs. It's not that they do not want help. A typical inquiry in a closed online group reads, I can't find my voices anymore. I can't find any safe place. Does anyone know a provider in my area who would not commit me? The answer often is no. Legally, a person cannot be isolated simply because they have a mental health condition, but often there is simply no options other than an outpatient assessment treatment or a locked up psychiatric ward. Mass scale violations of the Olmsted are a daily occurrence. Some keep searching for safe, unlocked places for providers who would respect their dignity and humanity. Others, sadly, believe that psychiatry is incompatible with humanity and join the rapidly growing abolish psychiatry movement. Mostly young people severely traumatized by mental health services, or they know somebody who was. Of course, these abolitionists, as they often call themselves, may be easily dismissed as marginals, but I urge you to see them as a canary in the coal mine. So many people are being victimized by the current system that it's getting unsustainable. It's bound to break one day. And in fact, the psychiatry abolitionists are getting closer to the mainstream. They used to complain how, say, members of the Black Lives Matter or the labor movement did not understand the evils of psychiatry. Now one hears more and more that racial, labor, and other activists finally get it and see how psychiatry is part of racial oppression or capitalist exploitation. And of course, the American labor movement is another example of how something that was marginal is having a resurgence and making an impact. So I'm here to beg you to take seriously the growing discontent with the mental health system and to make non-coercive, recovery-oriented treatment options a priority. So far, all this talk about recovery and lived experience has been tokenistic. People who are willing and able to reform the system from within have no real institutional support, no real funding. Please consider making a real investment in non-coercive alternatives that will restore public trust in psychiatry and prevent family tragedies described by previous commenters. Thank you.
Thank you so much. And we're going back to Mr. Creekmore.
Yes, can you hear me?
Yes, sir, we can.
Yes, I'm Dr. Edmund Creekmore from the National Shattering the Silence Coalition. I'm the Policy Action Co-Chair. Thank you for this opportunity to read a statement. Nothing about us without us is a statement often heralded by those who complain that policymakers too often make decisions about the seriously mentally ill and disabled without them in matters that vitally affect their lives. What about the families of the SMI with related neurodiverse mental health disorders? Too often, civil rights advocates oppose civil court-focused solutions to address these problems, such as mandatory outpatient treatment in Virginia and care courts in California. They argue that the court involvement is a violation of their constitutionally protected right to privacy and due process. However, it is estimated that 50% of the SMI, who according to the Treatment Advocacy Center statistics, suffer from a neurological condition called anosognosia that renders them too ill to know that they are too ill to make these decisions for themselves. Who then speaks for these individuals and their families' right to treatment, and so often without their families' knowledge and support? In Virginia, the mother of the late Irvo Otieno, who according to press reports died in the custody of trained deputies and medical orderlies at Central State Hospital in Petersburg, Virginia, is one who would likely bear witness to the fact that the dictum, nothing about us without us is likely to ring hollow. The seriously mentally ill and disabled are an underserved minority, as are all adults and child special needs populations with mental and physical disabilities. Are they to be left behind the national movement towards justice in the name of equity, neurodiversity, and non-discrimination under the law? When it comes to the seriously mentally ill and disabled, in my opinion, primary care begins in the home. For these at-risk individuals, parity and equity go hand in hand. We ask that professionals and policymakers think outside of the box. When we ask policymakers to consider family support peer services provided by adult family members related by birth, rather than exclusively by certified adult peers who are not related by birth. We suggest that both related and unrelated family support peers have an essential role to play at varying levels of licensure, expertise, and qualification for SAMHSA's redefinition of what a peer is. We propose that ISMIC consider a special SAMHSA planning grant to study funding individuals and families where they may have the requisite ability, qualifications, and willingness to receive specialized peer training under exceptional circumstances in which all may be called upon in response to a timely crisis involving 988 dispatchers and co-response teams during a potentially life-threatening domestic situation. Finally, as an independent forensic examiner, I support the National Judicial Task Force call heralding the role of courts as a major player in the movement known as therapeutic jurisprudence to prevent the unnecessary criminalization of the mentally ill. The courts must become more involved in matters of equity, justice, and neurodiversity in making provision for the chronically underserved populations they serve and protect in what is often their last legal refuge. Thank you.
Thank you so much for your comment, Mr. Creekmore. Moving on to Russell Stentz. Russell, can you please press *9 to raise your hand?
Can you hear me now?
Yes, sir.
Okay, good, thank you. Thanks for this opportunity to provide input to your committee. I'm a retired school psychologist who has worked with and advocated for students with a variety of disabilities, including those with psychiatric diagnoses. But it was my experience with my two daughters, both of whom came to be diagnosed with serious mental illness, that catapulted me into a whole new realm of advocacy. I've been appalled by how a system supposedly designed for healing can be so harmful. Both of my daughters have had multiple psychiatric hospitalizations, most involuntary, and have been subjected to forced injections, seclusion, use of restraints, and forced ECT. The coercive treatments my younger daughter was subjected to left her utterly traumatized and severely diminished in body, mind, soul, and spirit, and led to her tragic death shortly before her 21st birthday. My older daughter has rebounded after each of her hospitalizations, but bears the scars of each of these often lengthy and traumatic episodes. So I'm very concerned about the voices currently calling for increased involuntary hospitalizations and forced psychiatric treatment. I recently saw a 60-minute segment on California's, quote, care court, sponsored by Pfizer, and my thoughts went to how a local kangaroo court railroaded my youngest daughter into forced ECT and medications that did not help, but traumatized and debilitated her. Such courts make a mockery of liberty and justice for all, as the cards are entirely stacked against the patient. There is robust evidence for the efficacy of much more humane alternatives, such as open dialogue methodology, peer-led respite centers, soteria houses, healing homes, and empath emergency room units. If a fraction of the money that's now spent on conventional psychiatry were spent for those things, there would be so much better and more humane results. Even when hospitalization appears necessary, there's evidence that strong infusion of elements such as these approaches would greatly shorten hospitalizations and yield much better long-term outcomes. In such situations, truly personalized care, guaranteed access to friends and family, fresh air and sunshine are so needed. Psychotropic medications, if needed, should be utilized in a much more personalized and judicious manner. And just as we have an abundance of detox centers for street drugs and alcohol, I see a crying need for such centers for many fellow citizens who end up stuck on psychiatric drugs, usually a toxic cocktail with clear and significant adverse effects. And so they can have the same opportunity to be carefully tapered. Both of my daughters were in hospitalizations where they went for months without fresh air and sunshine, a free commodity that's quite therapeutic for all human beings, and that even convicted felons are guaranteed to have access to every day. This is terribly wrong. I see the need to strengthen and apply the principle of informed consent with regard to psychiatric treatment, including honoring advanced medical directives. There's also the need for competent and robust independent expert assessment and legal representation for individuals diagnosed with serious mental illness. As it is, there are far too many languishing in psychiatric incarcerations or other highly coercive situations whose treatments are clearly not helping them, with no real advocacy or hope of escape. Thanks for listening, and I hope that things can go in a much more humane and efficacious manner, and anyone who's suffering can have much better results than we're getting and we've been getting for the last, I don't know, several decades. Thank you.
Thank you, Mr. Stentz, for your comments. Moving on to Mary Ellen Stewart. Mary Ellen, if you could please press *9 to raise your hand option.
Hi, can you hear me?
Yes, ma'am, we can.
Thanks. Hi, I'm Mary Ellen Stewart, and I'm with the National Shattering Silence Coalition as well. Thank you, everyone, for your informative presentations today. It's really encouraging to those of us who've been asking for the national attention to be placed on this issue for decades. I applaud your effort and your dedication. During the opening remarks by Dr. Delphin Rittman, there were many slides, some showing data that cited 66.5% of those reporting they had a mental illness subsequently reported that they were in recovery. 97.1% of those in recovery attributed it to receiving services within their community. 66.5% does not accurately reflect the percentage of people with persistent serious mental illness who are actually in recovery. And 97.1% who are receiving community services also cannot be accurate unless you include services provided in jails. You on the committee know this. The effort you are giving to address serious mental illness is greatly appreciated by those of us who have a loved one with this disorder. Your work is really, really hard work. The resulting policy will be a testament to the hours you put in, only if it's rooted in an honest foundation. 66.5% recovery is not an honest count for those with serious mental illness, nor is 91.7% a reflection of community services available to those who are actually seeking them. Managing true serious mental illness is a lifelong struggle. Recovery does not mean a person can completely resume a normal life by taking medicine and going into therapy. Most require a supportive living environment. Families can try to provide it, but it's not reasonable to expect them to have the skill sets necessary or the time it takes to be proficient at it. There are excellent supportive housing programs throughout the country with decades of evidence-based treatment. A list of several in California can be found in a document called Housing That Heals. Links to that document are in the written comment that I sent to Ms. Pam Foote. Thank you, Ms. Foote, which I believe are going to be part of the official record. The wheel has already been invented to successfully treat persistent mental illness in a supportive housing environment. It's not inexpensive, but it's a superior value when compared to paying the daily rates for a psychiatric hospital stay and/or jail cells and/or lives lost wandering around on the streets. The results of community-based supportive housing are far better for everyone, including society as a whole. Your challenge is how to scale up or recreate these effective programs in all the states. There's no need to start from scratch. Organizations administering evidence-based care are eager to share their expertise. We all want the same thing, which is to provide quality of life to those who are unlucky enough to have this horrible illness. These established, competent nonprofits have tough missions, grand visions, and do the heavy lifting to treat mental illness. Every day they enrich the lives of very sick people and give hope to the families. My family is grateful to have found these supportive homes and lucky enough to have one in our area, in our community. There needs to be more spread throughout the US so everyone who needs them can have access to this community-based, medically necessary care. Thank you very much.
Thank you so much for your comments, Mary Ellen. And yes, your information you sent me will be incorporated into the official record and into the meeting minutes. Moving on to Leah Giorgiani. Please press *9 to raise your hand.
No response, Pam.
Thank you. Moving on to Felix Greener. Mr. Greener, if you are on Zoom, please press *9 to raise your hand.
No response.
Thank you. Moving on to Sean Murray. Sean, if you are on the line, please press *9 for Zoom to raise your hand, or *6 to unmute if you're on the phone.
No response.
Moving on to Nicholas DeMichael. Press *9 to raise your hand, or *6 to unmute.
Hi, thank you for giving me a chance to talk. I'm in a supportive housing program in New York, and I just wanted to say that as the model in New York is presently practiced, supportive housing is neither supportive nor does it encourage people to in healing and from their mental disorders. It can be a very demoralizing experience to be in the mental health system in New York City. That's it's basically run like a for-profit enterprise. That's all I have to say.
Thank you so much. We're going to go back through the list one more time in case anyone joined late. Starting back with Bianca from St. Augustine Shores, Florida. Bianca, if you're on the line, please press *9 to raise your hand, *6 to unmute.
No response.
Thank you, Selby. Moving on to Johanna Lester. Press *9 to raise your hand, and Zoom, press *6 to unmute.
No response.
Moving on to Green Thumb, AV Youth Wraparound Services. Please press *9 to raise your hand, press *6 to unmute.
No response.
Moving on to Stephen Bushlin. Please press *9 to raise your hand, *6 to unmute.
No response.
Moving on to Michelle. Please press *9 or *6 to unmute.
No response.
Moving on to Sandy Godwick. Please press *9 to raise your hand, press *6 to unmute.
No response.
Moving on to Al Galbs. Press *9 to raise your hand, press *6 to unmute.
No response.
Moving on to Sherry McEmsey. please press star 9 to raise your hand, press star 6 to unmute.
No response.
Moving on to Leah Jajorni, press star 9 to raise your hand, press star 6 to unmute.
No response.
Moving on to Felix Graner, press star 9 to raise your hand, press star 6 to unmute.
No response.
Moving on to Sean Murray, please press star 9 to raise your hand, press star 6 to unmute.
No response.
Thank you, Selby. That concludes the public comment section. Thank you to everyone who submitted comments to me. All comments will become part of the official meeting record and will be part of the official meeting minutes and have been shared with the ISMIC members. I'll now turn the meeting back over to Dr. Delphin Rittman for final comments.
Okay, thank you so much, Pam. And I also want to say thank you to everyone who submitted public comments and shared your public comments. It's so helpful to be able to hear directly from you, and you know, it really highlights just the importance of this work and also the importance of getting different and multiple perspectives. So thank you for writing your letters. I also want to, you know, just note, you know, so appreciate again this group and all the work that has gone into the ISMIC between, you know, our last meeting and this meeting. The work groups are just so in the zone, really, in terms of being able to look at important areas that impact and that can improve the lives of individuals struggling with serious and persistent mental illness. Also want to say I really thank the stewards for their work in leading their work group, and also the CMHS for you know, its leadership, and Dr. Everett leadership in terms of continuing to you know, move the you know, convene us and move us forward. Really just appreciate everyone's effort. I look forward to the next ISMIC meeting. We'll be hearing information about and an update in terms of the newsletter and also our report to Congress. So a lot of important work that will be happening between now and the next meeting. Also, I hope everyone has a great holiday season. We'll be meeting just after the holidays. And so certainly hope that everyone has a great holiday season and you enjoy the rest of the fall. Again, thank you for being with us and for everyone's work on the committee, and have a great rest of the day. So thank you so much, everyone. Take care.
The ISMIC meeting is now adjourned.